Okay, here we are again. My name is Ed. I'm in my 60s, and I've actually have two legs amputated. They're both a below the knee amputation, basically due to infection. 14 years ago, I had an infection on my foot, and basically each year it would be like left foot, right foot, left foot, right foot. Every year it was the other foot. So they would actually take a bone out or remove a toe and things like that. The final year that this happened was not November of this year, but November of the previous year. Okay. Um, it actually took half the foot in October. Okay. And then it wasn't healing. And after questioning almost every doctor that I had, if it was you, what would you do? And just about every doctor said yes. Just do it, get on with your life. So that's basically what was going on. So we scheduled a date, and it was being removed in November, beginning of November. So I go into the hospital, and it's 3 days that I'm in there for. It's kind of considered almost an outpatient surgery that I had it. And what happened is they removed the foot. They removed they removed the leg on November. When they removed the leg, I was 3 days in the hospital. Then they released you. Then there was 2 weeks for the stitches. You know, get the stitches. It was actually staples. So you could have either one, doctor's preference. So I had staples, and I had about 40 of them. Kind of a big scar there. Uh, a little bit of it was still bleeding at some of the staples. So my doctor, after 2 weeks of healing, my doctor took half of them out. So he took about 20. Go back there another 2 weeks. He took the other half out, and then I was on to the prosthetic. You go over to the clinic for the prosthetic, and first time that you go, they're going to cover like what is involved. They're going to give you like, okay, here's a type of foot. What type of work are you going to do with it? Uh, okay, well, each foot is different, so you have choices there. Each prosthetic is different. You have one that's a pin. Okay, now this is actually a liner that's actually has the pin on the end, and that slides into the prosthesis, and that's what locks in on that. Some are vacuum, and some are pin. There's a couple different ways that they do these things. Basically, mine's a pin. So what they do first, they actually start you off with a shrinker sock. Okay. Now this one is actually inverted, and you can see that it has like these little dots on it. These little dots are actually just to hold the sock into place. So it actually goes over your residual limb. Okay. And basically, I have one loaded on a tube. Okay. And you can see the dots right there. And having it loaded on a tube goes a lot easier because what you do is, let's say this is your residual limb, your leg. Putting it in the tube is a lot easier than trying to stretch the thing on. So you just put it through the tube, you go all the way down, and boom, you got it on the residual limb. And the thing is, you pull the rest of the way down. It'll be snugger than this. They call it a shrinker, and you're going to wear this almost 24/7. Wear it as you sleep. You can take it off if you're showering, cleaning up, and such. Now, there is another thing my prosthesis man said. Uh, Ace bandage. Everybody knows pretty much what these do. You want to wrap your leg in a figure eight. So you're crossing and then crossing. So it's going to be cross, 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 and that brings it down a little bit quicker. You're going to want to retighten these every few hours. Ask your doctor. Ask the guy who's doing the person that's doing the prosthesis. They may suggest to do this. Some of them may decide, hey, why don't we put two liners on instead of doing this? So different methods. Everybody has a different method to do. Uh, the thing is, I was wearing that for 2 weeks. After that, you go in for casting. Okay, on the next 2 weeks. Okay. Now, casting, what they're going to do, this gets inverted. This is what you're going to wear with your prosthetic. Okay. It gets inverted. Okay. Trying to invert it right now. Okay. And you can see it's like a white, it's like silicone on the inside. It's a liner that goes right onto the uh, tip of your residual. Some people call it a residual. Some people refer to it as a stump. I like residual. So you're putting your residual on, and then you're bringing it up and on top of your leg. So basically, this all goes onto your leg. We're going to call this your leg right there. Goes on your leg. Okay. This pin locks into the um, bottom of your prosthesis. And okay, this is actually the socket inside the prosthesis. It'll go in here. This is inside your prosthesis, and there's the pin. Pin sticks out, and it actually goes into the bottom of the prosthesis. Okay, there's a small trigger located in the prosthetic, and it'll clip right into that. Then there's a trigger, brings it on and off. Okay, a lot of different things. The foot's different, everything else is different. We're going to concentrate on this right now. After you shrunk down enough with the shrinker, which is about a 2 week period, you go back and they measure you out for the prosthesis now. Okay, they're going to put that liner onto your leg, onto what's left of your leg, and they're going to wrap it with like a cellophane wrap. Then they're going to put two uh, two socks on it, pretty much, one on top of the other. Everybody has a different method of doing this, so but mine kind of put two layers on top of each other, and then they put the markings that they need to all over, and then they put the uh, gauze bandage, and that's loaded with like a plaster, just like they make a cast if you broke your leg, broke your arm, or anything. It's the same material that they use for making a cast. So you get that placed on, and pretty much it takes about 10-15 minutes for them to put it in place. But then it takes 5 minutes on to cure. On the end of the where you had that tip, the pin, on the end of that they may put a scale on there so that they could actually imitate the weight. So they're going to pull your leg out and give it about 10 pounds of force coming out. This is so that your leg isn't sloppy inside the prosthesis. It will lock in better. Um, it just makes for a better fit. So anyway, you get the casting done, and then approximately 4 or 5 weeks after that, they build you the leg, and you have your choices usually. Um, this is what I did. Mine's just a black carbon fiber. I kept it simple. If you're if you're a veteran and you want Army on it or something, Navy, you could actually do that. You could put any branch of service you want on it. You could have any color you want. You could have flowers all over it as far as that goes. If you're maybe female and you've got your young kid, maybe the flowers may look good for you. Maybe some, you know, Captain America or such. They got a book that's loaded with them as far as what you want to do with it. Um, the thing is, you got to remember that's what it's going to look like. You can actually get them to put something that looks more like a leg over it, like you have the real skin there, and that way, if you're one who likes going out to dinners or things like that, and you don't want anybody to be like, oh, you got a fake leg. Um, the thing is, you can make it so that it looks like it's a real leg. So, uh, so anyway, the thing is, you get your cast made. Then that comes off. Then they make a clear plastic. Okay, it's just a temporary, and they fit you in this clear plastic. It's just like the black one that I showed you with the carbon fiber. It's a clear one so that they could actually see, does it fit right? Is it too tight? Is it too loose? What's going on? So they're able to actually see if there's any adjustments to be made. They're able to do those adjustments, and they're able to make your leg after that point when you go back and you try on the temporary. So everything's like a 2 week period. From November until about March, we had a little delay getting into physical therapy because of paperwork and everything else. Insurance usually picks up some of this. Sometimes you have to deal with a lot of the paperwork or financing, or there's a lot of stuff that you may have to deal with. Like I said, and check with your insurance companies. Sometimes they deal with it. They will put up so much for that. It may have something out of pocket, but everything's different. Every situation is a little bit different. Um, the Some of the places that you deal with will have payment terms. Uh, that's something that you have to deal with as far as between the paperwork. It's between the doctor, insurance company, and the prosthesis, the place that's doing the prosthetic. So, keep in touch with them so that they've got all the paperwork that they need. Everything is, what do you call it? I's dotted, T's crossed. So, anyway, the thing is, for the final prosthesis, it was probably about 5 weeks that we made the appointment for, but it was actually more like 7. So, anyway, on March, I finally took delivery of the prosthesis. Okay. And pretty much it was April, most of May, that I actually did physical therapy. I went to the hospital that I had the surgery done, and they actually have like uh, a gymnasium, a health club, or such. They have basketball courts, they got swimming pools and everything else, and they have the physical therapy and occupational therapy in that building. So for 16 sessions, twice a week, there it is. I went physical therapy. I started off in a wheelchair, then I went to walker, then I went using a cane, and basically I used the cane for security blanket. Keep it handy. If I need it, I got it. You know, maybe I'm not using it like I should. I'm carrying it around. I'm making sure that I have it so that, if I'm running across something that's a little iffy, I got that extra support of the cane to help me through it. And a lot of times it's just, in your mind, you just, like I said, security blanket. You gotta find your balance. You gotta find, uh, you know, find that in your own mind that this is going to support you. This is going to work. And needless to say, it does. It does. You don't have the feeling that you have with a foot. Uh, but the thing is, there's all kinds of practice that you could do, and you can make it work for you. So, if I could do it at my age, which is just a little bit above 60, I think anybody else could do it. If you're 30, 40, you know, 60 years old, I'm able to do it. And could I do it at a later age? Yeah, I think I could. I think I could. If I was 70 years old, I'd probably still be able to work it with no issues. The thing is, the older you get, it gets a little more difficult. So, um, basically, like I'm saying, I think a lot of people, could actually master the use of a prosthesis. And I hope I gave you a little timeline there. So, basically, my issue was October, November. It was foot off, leg off, October, foot, November, leg. And then I went all the way until pretty much the end of May. So pretty much you're talking 6, 7 months. So, that's the way it is. I'm hoping to have more stories for you on different practices. I'll get a little bit more involved as far as what PT, everything else. If you have any ideas, shoot them over towards me. Subscribe and shoot them over towards me. And we'll see. Maybe we could do something with them. I'm thinking like transfer boards. I'm thinking like use of different things, different materials. That you think like an aerobic stair climber. I got a prosthetic leg. What am I going to do? Aerobics? No. It may help you to get off the floor, up and down off the floor. Different things to have handy. Transfer boards are useful. Wheelchairs. There's a lot of different wheelchairs. Some of them, I'm not trying to sell you anything. I'm not trying to sell you a wheelchair, but there's a lot of things that you have to look at. A lot of things you got to look at as far as your normal furniture too. Stuff that you're going to have just to have your regular furniture in the house. Uh, Things are a little bit different, and you're accommodating more for your height, your weight, everything when this happens. So, if you have any ideas as far as subject matters or anything that works for you that may, be something that may work for others in the community like that, uh, give me a holler because maybe, we can put them on and, see what everybody thinks. Maybe it's a great idea. Hey, wow, you got a great idea there. Let's see if everybody else thinks it's got merit to it and everything else. Let's do this. So, uh, hope to bring you a lot more and hope to talk to you soon. Okay? But for right now, have a great evening. Oh, and by the way, have a great New Year's.